Hi, this is Dr. Gogas, Editor-in-Chief of USC Journal, and today I'm very pleased because I have with me Professor Myung. Professor Jeong is Director of the Heart Center at the Chonnam National University in Gwangju, South Korea. He is Director of the Stent Research Institute at the same university, but also he is the PI of the largest myocardial infarction registry in South Korea, so-called KAMIR registry. Professor Jeong, thank you so much for being with us today. And I'm very excited and I can't wait to hear your leading Cath and Translational lab that you have created in Gwangju, South Korea.
Thank you for your kind invitation, Dr. Bill Gogas, Editor-in-Chief of U.S. Cardiovascular Review. My name is Myung from Chonnam National University Hospital, Gwangju, Korea. I'll introduce the history of cardiovascular intervention, STEM researches, Gwangju International Cardiac Symposium, and Korea acute myocardial infarction history. This is Chonnam National University Hospital. We have 111-year history. We are doing Korea acute myocardial infarction history. These are major CNUH history of cardiovascular intervention, and we have performed cardiovascular intervention since 1987. We set up animal cath lab 1996. We have started intervention cardiac symposium since 2005. Korea acute myocardial infarction history since 2005. And our research center nominated by Korea Ministry of Health and Welfare 2008. We set up Korea Cardiovascular Research Institute in 2010. We published 1,000 papers 2014. We developed Chonnam National Hospital Center 2014. We have performed peak heart experiments, 3,000 cases 2018. These are cardiac cath lab between 1982 1989. I set up animal cath lab first time in Korea, 1996. This is the number of PCI at Chonnam National University Hospital since 1987. We are doing largest number of PCI in Korea. These are current trials in animal and human cath lab. We have developed many types of drug-eluting stent, gene and cell therapy, cardiovascular imaging modality, and cardiovascular MicroRobot. In our hospital, we have a large number of acute myocardial infarction patients. We have animal cath lab, and we presented a large number of papers every year. And our research center nominated by Korean government. And we set up Korean Stent Factory and Korean Research Institute. 2010, we have good research power on stem cell, hypertension, and cardiomyopathy. We had a memorial symposium 1,000 peak heart experiment 2009. Our research center nominated by Korean Ministry of Health and Welfare as a cardiovascular convergence research center. We had a memorial symposium of 2,000 cases peak heart experiments 2014. 3,000 cases peak heart experiment 2018. We set up Korea Cardiovascular Stent Research Institute and Stent Factory 2010. We developed our own design coronary stent. Chonnam National University Hospital stent is better than Promise, IPO, Resolute, and Giant stent in terms of flexibilities. Commercial name is Tiger Stent approved by Korean Ministry of Health and Welfare and Korean FDA, and successfully launched in 2015. We developed many types of Tiger-based drug-eluting stent. We developed polymer-free drug-eluting stent, eluting stent using nitrogen-doped titanium dioxide film deposition technique. We received US patents. We developed bioabsorbable drug-eluting stent using 3D printing system, first time in the world. We developed polymer-free eluting stent using femtosecond laser. This femtosecond laser stent improve endothelialization, inhibit inflammations. We developed smart stent attached to microsensor. This smart stent can detect early stent thrombosis, restenosis using our cellular phones. We developed cardiovascular MicroRobot using Minifig model 2010. We have started Gwangju Intervention Cardiac Symposium and live demonstration 2003. We invite Dr. David Holmes and Dr. Robert Short. We invite many faculty members from United States, European country, and Asia Pacific region, especially from Mayo Clinic. 2018, I invite Dr. Bill Bogas, and 2019, I invite also Dr. Bill Bogas. Last year, we had a virtual conference due to COVID-19 pandemic. Korea acute myocardial infarction has been studied since 2005 for the memory of the 50th anniversary Korean Surgeon Society. KAMIR study supported by Korean Society of Cardiology and Korean NIH. We have registered more than 76,000 patients so far. We published 300 papers, including JAMA, BMJ, Circulation, JSCC. We reported triple antibody therapy in STEMI patient underwent primary PCI. We reported benefit of statin therapy in patient has very low LDL cholesterol. We reported STEMI patient is multivessel lesion, ARB in STEMI patient, very invasive treatment versus primary PCI in STEMI patient, multiple PCI in STEMI patients suffering from cardiogenic shock. Recently, we introduced KAMIR score for guiding P2Y inhibitor, especially in Asian patients. 2013, I introduced KAMIR study to my Japanese friend during JCC meeting. After that, they made the JAMIR, and we had a KAMIR JAMIR Symposium in Korea and Japan, Kanazawa, Osaka, Yokohama every year. And we have KAMIR JAMIR Symposium in Gwangju, Korea. Also, I introduced KAMIR study to China. We had a KAMIR Chamir Joy Symposium every year in China. And also we have an Asian acute myocardial infarction guideline meeting during case meeting. We tried promoting committee for Korean Nation Heart Center. We set a Korean Nation Heart Center in Gwangju, Korea, near the Stent factory and Stent Research Institute. I have written more than 1,700 papers so far. My hobby is collecting pink miniatures over the world. I hope all of you enjoy coming GICS meeting, which will be held second weekend of June. Thank you for your attention.